I'll try to explain in English. I'm not a very good English speaker. If I said to the patient that when I speak in Spanish, I look a little bit more intelligent. Not so much, but a little bit. But I try to speak in English because I see so many patients from Norway, from Sweden, from other countries. Sometimes we can help in some ideas. And it's the circumstance of this woman. I know his mother, and finally she convinced the daughter to come here from Norway to see me because she have a pain and the doctor don't find what's the reason. But they found that something happening in the esophagus. She have veins in the esophagus. And she has a stone in the gallbladder, and they don't find nothing. And finally, they think that she drank alcohol, and this is the reason for the liver inflammation and the vein in the esophagus, and with the risk for broken and bleeding. But she don't drink alcohol. Occasionally, in holidays, a little bit, nothing, occasionally. And this is not the reason for the liver problem. She have operation in the stomach to reduce the stomach in 2006 because she have obesity. And after the operation she did, change the microbiota because the pH, the acidity of the intestine is different. And so the microbials, the good microbial we have in the intestine, they love the acids. They love the acid. But they don't like so much the bile. And also when she take omeprazole, sumac, the acid is not so much. And so slowly, in 14 years, the microbiome changed. The intestine is inflamed because the effect of this aggressive bacteria and the leaky gut, the permeability of the intestine, produce that toxic from the food, maybe gluten, maybe other things, affect to the big filter that we have, that is the liver. And it depends on the genetic of the person, the repair of every inflammation produce more or less fibrosis. And in 14 years, she have a fibrosis in the liver that produce high blood pressure in the portal system, and the blood is easy for the blood to go to the vein in the esophagus and to the spleen. But if we continue in this idea, she cannot improve. It's necessary to go to the beginning to stop the process that she began at the day she did the operation of the stomach. Understand?
Yeah.
Thank you.